our children confide in to seek advice on drugs and other at-risk behaviors. The results of a recent youth survey might surprise you. And Dr. Constantine Ioannou joins us to discuss the Psychiatric Residency program at Stony Brook School of Medicine.
And what we really focus on at Stony Brook is the diagnostic interview. How do you sit in the room with a person who happens to have mental illness, and how do you develop a relationship in that limited time that will allow you to treat the person most effectively?
And we revisit the first Partners in Prevention Conference held at Brookhaven's Town Hall. Hello, I'm Art Flesher from Suffolk County Health Department's Division of Community Mental Hygiene. I'm your host of Something of Substance, our monthly video magazine. Welcome back. Each month we show how substance abuse, mental illness, and developmental delays affect you, your kids, and your community. We'll also give you a few examples of how services in Suffolk County help people find the inner resources they need to tackle their problems.
Where's Mom? Did she forget me? I wonder what happened to her. What if I get left here?
Drugs and alcohol may make you forget your problems for a moment, but that's not all you forget.
My mother worked hard to be in recovery, and I love her for that.
A recent student survey indicated that coaches of high school athletes are likely to be one of the first people that students will choose to discuss topics related to substance abuse and other at-risk behaviors. This relationship of trust and open communication is an area that advocates in the prevention community would like to strengthen and provide additional education to these mentors.
So we were here this morning at Mill Pond Country Club.
Today the goal was to do a couple of things. We had a certain amount of hours and tried to plan the day to be able to do several things. One, we invited about 15 agencies to be able to be a resource so that the coaches can go and visit the table, ask questions, make some relationships, be able to get information so that if they did identify something, they can provide something for their students. Secondly, it was about bringing in some speakers that might be able to connect with the audience. So myself, I gave a little bit of an overview about community solutions. Linda Ventura, who's a mom who lost her son, who gave a perspective of a parent. Tom Goris, who is a young man who's in recovery, who was an athlete, who has gone through the struggles of addiction and has been sober for almost a year. So we gave them several different views, and then we brought in a speaker, John Venza, who talked about the current trends.
Yeah, a short while back, we hosted a youth forum over at Outreach House in Brentwood. And at the end of the forum, we got some questions and answers from the young people. And when the data got crunched, one of the things that was pretty obvious was when they were asked the question, who would you speak to about a drug problem for yourself or for a friend or something, they said coaches. So coaches got identified as a go-to person.
So we really gave them a parent's view, of a young man who struggled with addiction, and then we gave them a professional outlook of the current situation and what potential answers they can be to the situation.
Well, we all know that right now heroin, drug use, it's prevalent in all school districts.
We hear people talking about the opiate issue and an epidemic, and it truly is an epidemic. It's been classified by the CDC as an epidemic, but it's more than just a classification. We're seeing kids from all different socioeconomic backgrounds throughout every school district being impacted by this.
Section 11, who is the governing body for Suffolk County Athletics, felt that we needed to take a proactive approach.
Section 11 is an arm of the New York State Public High School Athletic Association. It's our job here in Section 11 to govern and administer the athletic programs of the student athletes of Suffolk County. We serve as the administrative arm of the State Education Department and the Commissioner of Education.
Well, we're trying to get a better understanding of the issues facing our athletes and our students here in Suffolk County, and to see how we as educators can help out to educate the students and the parents against drug and alcohol use.
Today is important because coaches play an integral part of any child in especially high school's life, their student life. My son Andrew had such a special connection to his coach, and he often has told me, if you don't respect your coach, you don't respect anybody, nor are you afraid of anybody. So they have a lot of power in how a young athlete, a young student will come through high school.
We felt that student athletes, their number one go-to person is the coach. So as director of athletics, we felt it was our job to put out something where coaches are in the front lines being able to reach out to their student athletes in the case that they need some type of help with drugs or addiction.
Very often coaches are also health teachers, they teach gym class, so where they're critical and pivotal with their student athletes, they're also pivotal and critical in their unique relationship in the coursework that they teach in gym class or health class with the entire student body. So they build different rapport in their classrooms, I think, than other classrooms. That's not to say that other teachers don't build that rapport, but just the subject matter and the setting allows them to build this tremendous relationship with them that they avail themselves as that type of adult person that they can go to if the problem or if there's something they need to talk about.
Yeah, I think the important piece is with Anthony and John coming in, I think it provides some firsthand knowledge. In some of the cases, we've heard people that have gone through some challenges and through some struggles, and how they've been able to use resources and how they've been able to move on positively in their lifestyle. And certainly with John, his expertise and the guidance and some of the resources he's provided our athletic directors, I think is going to be critical.
The unique relationship that athletes have with the coaches is the feeling of trustworthiness, comfortability in going to them to speak with. Many coaches establish a solid rapport with their student athletes, and there's a level of, again, I go back to being comfortable speaking to their coach or to their physical education teacher or to their health teacher. So that relationship and that rapport really opens up the lines of communications in a world very often where kids remain closed off.
The coaches have such an impact on their athletes, on their student athletes, that if they are aware that their team is going to football parties that include alcohol and pot, then they need to step up and they need to, whether that's their star player or not their star player, bench the player, intervene, and do whatever's necessary to stop the cycle where it is and show the rest of the team that it's unacceptable behavior.
One of our goals was to help coaches and the athletic directors understand the key role that they play with the young people in their charge. They have a special relationship with these kids. Sometimes it really helps out when kids are in conflict with their own parents, and they have the opportunity to help these kids through some difficult stuff. When drugs and alcohol come into the picture very often, these folks are fantastic resources. We wanted them to understand A, the importance of the role, but B, also build a little capacity, give them a little bit more knowledge, information about some of the contemporary trends, why they're so important, why their relationships as caring, healthy, appropriate role models are really, from a resiliency paradigm, so critical to these kids. And I think sometimes, they do such a great job and they do what they do the coaches day in and day out with these kids, but not really knowing and hearing from the professionals in the treatment field, hey, you don't realize how important you are to these young people in battling back from some of these risks they're exposed to.
Student athletes, as has been pointed out today in the workshop, I think one of the most influential people in their lives is the athletic directors and their coaches. Oftentimes, they're spending as much or more time with the coaches than they are at home because of the many issues and in today's society. And it is our hope that the coaches will provide positive examples for each of the student athletes.
Besides educating the student athletes, it's important that we educate the parents as well. We need to make sure just the lines of communication from student to coach, we want to make sure the lines of communication from student or child to parent is prevalent as well. And as a coach or coaches, what we can do is, just like we're educating our student athletes, we need to educate parent meetings. A workshop like this in our high school would be fantastic.
I think the biggest thing that I got at this was being able to let coaches know how much their athletes think about them and the special bond that they have that even their own parents don't have.
We'd like to thank Section 11 the high school coaches in Suffolk County, the participating agencies, and advocates in the prevention community for facilitating this important forum. For more information on prevention-related events like this one, please contact the Prevention Resource Center at area code 631-608-5014. Up next, Dr. Konstantin Ioannou from Stony Brook School of Medicine joins us to discuss their psychiatry residency program. We'll be right back.
Who else has been taking your prescriptions? Keep your medicine and your family safe and secure. Mind your meds. To learn how, visit the partnership at drugfree.org.
I had no idea it was going to be so hard. I didn't know what to expect. You hear the stories, but I never took any of it seriously until I found myself here. And then I realized I was going to have to work hard for my recovery.
If you or someone you know has a drug or alcohol problem, you are not alone.
Recovery was the hardest job I ever had, and the most important.
Most of us have watched medical TV shows on life in a teaching hospital. Today we have the pleasure of talking with a real teaching doctor, Dr. Konstantin Ioannou, from the State University at Stony Brook School of Medicine. Dr. Ioannou is the Director of Adult Inpatient Psychiatry in the school's residency training program. His treatment specialties include addiction and substance use disorders. Dr. Ioannou, thank you so much for joining us today.
Thank you for having me.
Great. We're looking forward to hearing about what it means to be a medical student and how one chooses to become a psychiatrist. So let's start with medical school. What can you tell us about that? People they enroll in medical school, they obviously take the tests ahead of time, have to do well in undergrad, and then they're there.
Absolutely. It's a very competitive entry. You have to go through your 4 years of undergrad, usually get very good GPAs, high scores in your MCATs, and then you are accepted to a medical school.
Okay, so they start in the residency program, and what's life like for them?
The first year is a relatively difficult year. It's when they're just beginning to learn the basic skills of doctoring. So for psychiatry, the first year has 4 months of internal medicine, 2 months of neurology, and then 6 months of psychiatry. Mm-hmm. And basically, the idea is that since psychiatry is truly a medical discipline, they need to understand what the more pure medical disciplines do. And in particular, neurology is our sister specialty.
Yeah.
The 6 years in psychiatry is spent really learning how to diagnose, how to assess, and how to basically start a treatment plan. And what we really focus on at Stony Brook is the diagnostic interview. How do you sit in the room with a person who happens to have mental illness, and how do you develop a relationship in that limited time that will allow you to treat the person most effectively?
Now, just step back for a moment. Residents, however, from the beginning, are they able to prescribe? Are they doctors at that point or not?
They are considered doctors.
Okay.
They prescribe. However, in their first and second years, a great deal of their work is under the direct supervision of the teaching physicians.
Okay.
So a first year, for example, will have to show a competency, mm-hmm. that they know how to interview, that they know the basic treatment plans, that they understand the basic pharmacological plans, and then they're given the ability to work more independently in their second year. We call them milestones. They achieve certain milestones, and once they achieve those milestones, they go on to the next. And the closer they get to their fourth year, the more and more independent they're expected to be. Mm-hmm. And their ability to prescribe and treat becomes pretty much done in the context of a supervisor, but the supervisor doesn't necessarily have to be in the same room with them.
And of course, technology must play a bigger role than it did at one time, huh?
Technology actually is very interesting as far as research goes. But the ability to use the technology for day-to-day clinical work is relatively limited. So we do have MRIs, we do have blood tests, we do have access to various different types of scanning, but psychiatry still pretty much focuses on good old-fashioned interview, differential diagnosis, and creating an individualized treatment plan. And the technology at Stony Brook is actually far advanced in many other places. We are using that to basically broaden the knowledge of the field, and in general looking at issues such as depression, suicide, schizophrenia, and we are hoping to actually expand it into the world of research and imaging and addiction, for example. So there's a lot of stuff that we're doing on the research side that will eventually correlate to some sort of clinical changes.
You know, in talking to you, I could see how valuable it would be for residents to have the opportunity to work with you. What's it like for you to work with the residents?
It keeps me young. One of the advantages of being in a teaching hospital such as Stony Brook is that you can't rest. You have to continuously upgrade your own knowledge. You have to continuously read. You feel responsible to provide the most up-to-date, evidence-based practices to your trainees. And as such, being part of the faculty allows us to do that. It also allows you to basically ask questions that people in non-teaching hospitals usually don't have the opportunity to ask. So we actually have the ability to take a little time and think, is this the best option? Should we study this question? One of the things that have come up recently is the increase in violence in psychiatry. And we were able to do some literature searches, look at modalities to change it, some evidence-based practices, but then we're raising basic questions. What is it that we could learn more from these actual patients themselves? What makes them different than the patients, say, 20 years ago? And we have found some correlations with mild traumatic brain injuries, the increase of psychoactive drug abuse, and also looking at some of the correlates of violence in those with new synthetic drugs, which bring out certain types of violent deliriums. With that comes the ability to treat them. How do you treat them differently than you used to? And so that's the fascination of working in a teaching hospital.
This has been a very interesting discussion. If people wanted to learn more about psychiatry training and some issues surrounding Stony Brook's involvement with it, how might they contact?
Well, they could basically call me directly. My number is 631-444-2990. They will be able to reach me or leave me a message. I'll get back to them. And they could ask me any questions they have about how to pursue careers, how to apply for a residency, or even some advice on medical schools.
Sure. You may get some calls.
I hope I do.
Thank you so much. It's been great.
Thank you.
Up next, we revisit our segment on the Partners in Prevention Conference. Stay tuned.
They'll be fine, I hope.
What if you could prevent a young person from getting hurt or killed?
What should I do?
If you could turn back the clock and stop an underage drinking party from ever happening. Now you can. Pick up the phone and call 1-866-UNDER-21. It's your community, your call, and it's completely anonymous.
In our archive segment this month, we revisit the first Partners in Prevention Conference. Members of the prevention community, schools, treatment programs, and community coalitions gathered to explore resources and discuss strategies in the prevention of underage drinking, substance use, and other issues.
Today is the first annual conference of the Partners in Prevention program.
Today is about bringing members of the prevention community, coalitions, and even schools and colleges here today to talk about underage alcohol use as well as substance abuse, and getting participants to learn about theories in prevention, most importantly environmental strategies.
We're a task group who is under the Drug and Alcohol Subcommittee, and it's one of the first times that we have a group of local prevention providers operating in linkage with each other to provide prevention education, as well as other advocacy type programs and community-based programs here.
The tables that we have here today set up the resources that we have for Suffolk County, all different educational programs, parent, community, individual prevention activities that can be, most of them are free of charge to local areas.
The Prevention Resource Center, which is an organization that really networks the majority of us and is a huge information center regarding prevention in the area of substance abuse for all of us.
This was a great experience for me. I've worked many years on the treatment provider side of the community. And so I've always been interested in prevention because a lot of times I get to see clients who fail to take in those preventative measures that we talked about today. So today was a really empowering experience to come here and see how we as a community and on a state and a county level come together to better serve our young adults.
Well, we wanted them to understand that it's not a one-person event or a one-shot deal that is going to make a difference in changing norms around the county. We really wanted people to understand that it isn't the responsibility of the school or the parents alone to foster really good living skills, healthy living skills among children and adolescents, and that it really is a partnership that is required to do that.
We had several breakout groups. The community-based breakout group was making actions in mobilization in the communities, using environmental strategies. The family was about talking about families, how getting parents involved, and how families play an important role in preventing underage drinking and drug abuse for adolescents.
Well, what I picked up was that I came here and the resources are incredible, which I wasn't privy to before. So I walked away with a lot of materials that I can bring back to work and a lot of materials that I can bring back to home for discussion.
This morning we had a keynote speaker, Dr. Ken Winters, who has done a research-based program called Teen Intervene, which is a 3-session program that many of our providers are trained in. It's very effective in intervening with young people to help them network, to listen to them, find out what their difficulty is, and to network them to resources within the community. So there are several providers that are there.
Dr. Winter's presentation at the Brookhaven Town Hall was amazing. The way he gave his information to the group that was here today was something that parents can wrap their arms around. He addressed the development of the adolescent brain in such a way that made it very clear that we need to raise our standards in how we handle underage drinking. That it's extremely important that we raise those standards, have law enforcement behind us, and use those funding dollars to have our communities raise healthy youth.
Well, this morning's piece by Dr. Winters was particularly informative for the overview of how the brain develops and the lifespan and that. And I also sat in on the family session, and we talked about assets and values and protective factors, and that was just interesting as a parent myself, you know, as a good refresher as to what we need to be doing on the home front.
The prevention providers, we were all doing different work in different areas of the county, and we came together to make a collaborative effort that we can all work together.
Well, one message I think is important is that in order to deal with a complex problem, you have to have numerous organizations working together, and that includes law enforcement, prevention, schools, judiciary, faith-based, to come together and comprehensively put together a plan to deal with the problem in the area. Again, underage drinking is a complex problem, and it requires a unified response, a coordinated response.
So what we're doing here together is really trying to give information to everyone regarding evidence-based programming that's effective in the area of prevention, especially in the area of substance abuse prevention. And that's what the day is about.
For more information about prevention in Suffolk County, contact the Prevention Resource Center at area code 631-608-5014 or go to their website at www.liprc.org. We'd like to thank our viewers for tuning in to Something of Substance. Our video magazine is a public resource, and we're eager to hear your feedback, as well as any suggestions you may have for future show topics. For all inquiries and concerns, please contact me at art.flesher@suffolkcountiny.gov. I'm your host, Art Flesher. Join us again next month for more of Something of Substance.
Who else has been taking your prescriptions? Keep your medicine and your family safe and secure. Mind your meds. To learn how, visit the partnership at drugfree.org.